Hello everyone, my name is Brooklyn Swanner. I am going to be talking about a very serious subject today, taking depression seriously. The purpose of this informative speech is to build awareness of depression by sharing my personal and professional experiences on the topic. I hope to raise awareness of the topic of depression to inform others of the battle that many people suffer from in their common everyday lives. Over 17 million people in the United States alone suffer from depression. I will be talking about a type of mental illness called depression. Most people suffer from it every single day. Then again, no one talks about it like they need to. I hope to gather awareness for this topic and help those who do not suffer from depression to have an insight of the mind who do. Depression is a common and serious mood disorder. It can cause severe symptoms that can affect your mood, thought, and even daily activities. Some of the signs and symptoms of depression include feelings of hopelessness, feelings of guilt, irritability, loss of interest in common everyday activities, appetite, or weight changes. The Mayo Clinic states more symptoms in older adults, such as physical aches and even memory difficulties. Depression usually begins in adulthood, but can happen at younger ages. There's some risk factors to consider while learning about depression, such as personal or family history, major life changes, trauma, or physical illness. Now that I've talked about the overview of depression, along with some symptoms, I'm going to be talking about my personal experiences with depression. Growing up, I never really thought how it affects everyone's mind. As you get older and you get responsibilities, you start to notice how stressful things can get. My personal experience with depression involves most of these symptoms that I talked about previously. Some days I cannot get myself out of bed because of my everyday battle with this disorder. I have lost a very close family member within the last month to this illness. My cousin was 20 years old. She seemed perfectly healthy. She did not show symptoms until she lost the battle to suicide. This shows how strong this illness is if we do not bring awareness to it and notice the people who do not show any symptoms or talk about their depression. Many people dealing with depression want to get better. There is, however, a percent of people who do not want anyone to know that they are dealing with depression. Depression and suicide are linked, although only 60% of people that commit suicide are diagnosed with major depression. Now that I've talked about some of my personal experiences, I'm going to talk about my experiences working in the emergency room. Working in the emergency department of our local hospital, I see more psychiatric cases than I see physical medical emergencies. When anyone visits the emergency department, while being seen, you are asked a great deal of questions about your medical emergency. You ask things like, do you feel safe at home? Have you had thoughts of harming yourself? When these questions are answered, we then decide if you need to be in a room where you cannot harm yourself and your belongings are stored in a locked room. If you are at high risk, an emergency room technician will sit one-on-one with the patient and document their activity every 15 minutes. While sitting with these psychiatric patients, you get to know them as a person and what they would like to help with. Patients may or may not be aggressive due to how intense their psychiatric behavior is. Patients go through a screening process with the mental health facility to try and get a patient the help that they need. Now that I've talked about my experiences in the ER, I'm going to talk about some of my fellow colleagues' experiences working as the nurse, taking care of these patients. Working with the nurses, I learn a lot about the psychiatric patients. I get to experience firsthand the needs and wants of the patients. I interviewed my fellow colleague, Anna Glasgow, registered nurse, on her intake of being the patient's nurse and how they need to be cared for. Anna Glasgow shared with me the experiences she has had being the nurse to most of the psychiatric patients we see in our emergency department. She explained to me that these patients that are suffering from psychiatric problems such as depression come to us for help. It is our place to do everything we can as healthcare workers to get these patients to the facilities they deserve to get the help that they need. With the lack of mental health institutions in Alabama, it's not always simple to get them to where they need to go. Working in an emergency department, we are trained to keep the patient's physical body stable, but we are not trained on how to keep the mind stable. Those are some of the experiences Anna Glasgow had. Now I'm going to transition to ways to cope. There are quite a few ways to treat depression. The first treatment is medication. Most people go on medication for their depression. It's usually taken to reduce the symptoms, but it's also combined with psychotherapy, such as talking to a therapist. If the medication and psychotherapy do not work, there is also a treatment known as electroconvulsive therapy. It is typically used if medication does not work, and beyond treatments, you can set goals for yourself, be active, try not to isolate yourself, and discuss things that you need to improve on with others. Depression is a type of mental health disorder that affects many people. Even some of your loved ones can be fighting their battle every day. I hope everyone will take a small portion of this information and share it with the people you know to raise awareness of the mental illness and hopefully save others by being aware of what people are battling in their minds daily. Depression is something that is not a joke. If we take it seriously, everyone can hopefully get the help that they deserve. Thank you.